one of the things we want to dive into is, how much primary organic brain injury is there? So if we're seeing suppressed voltages and delayed P300 times, that's suggestive of someone who's really struggling with a lot of primary brain injury. And we're going to be much more likely to get them involved with a lot of the therapies that are out there that can help, whether it's vestibular rehab, sometimes even moving towards hyperbaric and some of those complex things. A lot of times need cognitive behavioral therapy, so on and so forth. So those markers can guide us. If the P300s look really good, it's also nice because it can be reassuring for us. So we can go to the patient and tell them, listen, your voltages look really good. We still have to address issues with your mood. We have to address issues with your sleep maybe. We have to address issues with neck tightness possibly. We have to address issues with your oculomotor dysfunction. We still need to address these things, but at least we know that the voltages, the P300s look good. And that can be very reassuring and empowering for patients who may think they have permanent brain damage and so on and so forth. So that's one scenario. Another scenario, someone who is really struggling with a lot of primary brain dysfunction, it can be validating for them to see that a test that's looking at brain function is showing that, look, you do have significantly delayed P300s, your voltages are very suppressed, your brain map looks really abnormal, and it sort of helps guide them, because a lot of the patients that have had prolonged symptoms are often being told it's in your head. Why is this taking you so long to get better? And of course, the classic neuroimaging, like a CT or an MRI, which is a structural or anatomic test, is going to look normal in a lot of those cases. So really, you're dependent on functional tests, such as the QEEG, the P300, the WAVI test, to really be able to tease out the primary brain injury that a lot of these folks have.